everyone. Welcome to another section. Welcome to Loom Foundation weekly webinar. Thank you for joining us as we are streaming live right now. Welcome to another section. Okay, I had to so please mute yourself if you're not speaking. So we have a packed day for you. You're gonna get presentation on a little overview on arthritis, because we've been hearing like people talking about arthritis, so we want to just do a presentation to you concerning that. After that, that'll be for about 5-10 minutes. Then we take question and answer regarding that. Then after that, you hear from Dr. Crony. She will give us update on the COVID-19 vaccine, all that had to do with it. And she will touch a little bit on polio. And then the last person you're going to hear from is going to be Dr. Sunday, who will be talking about monkeypox, virus vaccination, and all updates regarding that in our community. So let's start. Are you ready? Okay, ready or not? Here we go. For those of you joining us on YouTube, we want to say welcome. Thank you for joining us. Okay, so arthritis. In the United States, we have 24% of all adults, or 58.5 million people that have arthritis. So it's a large amount of people that suffer from arthritis, and some people's condition are very severe to the point that they're on disability. So it's really actually the leading cause of disability in the country. So we're going to look at a little bit of myth or like the facts regarding arthritis to see which one is the truth. There's so many things that's going on. So can you guys put in the chat, just one thing you have heard about arthritis? So I'll see maybe it will be covered in. Tell me one thing you've heard about arthritis. Anything, just put it in the chat. Let's see what you guys think, what you have heard. Let's feel the pulse of the audience. Okay, lack of exercise. Sister Rosie is saying arthritis is a result of lack of exercise. Okay. Anybody else? Any other thing you have heard about arthritis? Okay. It's hereditary. It's for older people only. Yes, yes. It's old people's disease, right? And I've heard about that too. So let's some of the things I was able to pull up. Let's see. Okay, now that's the first thing. I'm too young to worry about arthritis. It says false. So there are several kinds of arthritis. Two of the most common one is rheumatoid arthritis and osteoarthritis. So rheumatoid arthritis has been diagnosed in people as early as in their 20s. So it is not the disease of the whole. And osteoarthritis has been diagnosed in people ages 30 to 45. So that is not the truth. I should not exercise with arthritis. I mean, come on, my bones are already aching. Why should I move them? I need to keep them still. Right, Sister Rosie? I want to keep still because they're hurting. Okay, so 1 in 3 adults with arthritis are not physically active. So physical activities can help with pain, flexibility, and range of motion. Get active today and try walking, gardening, strength training. We're not made to be couch potatoes. Like, we're not made to sit still. That's why we have joints and things that move up and down, right? So we're made to move. So that's why it's important, for us to still continue to move. Okay, this is something that is very, very controversial. I read a lot of articles about this. Different people goes in different direction regarding this. If I feel joint pain, I should stop eating tomatoes, potatoes, and eggplant. So these are vegetables and fruit that contains a lot of what is called solanine. And that really, it says it affects. It creates more inflammation and affects the joints, the inflammation area that really all mark of the osteoarthritis. So it's important. But one of the things that I found out is that it's inconclusive. So some people say that vegetable cause flare-up, inflammation in rheumatoid arthritis. Studies do not support that nightshade vegetable make arthritis worse. So this kind of vegetable, they are called nightshade vegetables. It's recommended to stop eating them for 2 weeks if you're having like an like a flare up, and then with time determine if you're not allergic to them. And of course, you want to seek the advice of your doctor, who can run tests and be able to determine and give you a recommendation while they work in collaboration with dietitian to determine if that is something you should continue to eat. But it's not like a blanket saying that, oh, I have arthritis, I cannot eat tomatoes. So you want to just out there. So let's look at these wonderful pictures. The pictures speak 1,000 words, right? Okay, we spoke about two major types of arthritis: the osteoarthritis, wear and tear. That's basically what arthritis is mainly is. Usually affect the hand, the hip, and the knee, where the cartilage within the joint begins to break down. So you can see the areas that are being affected, that could be affected with osteoarthritis. I mean, sometimes you have pain in your finger. My husband, he thinks there was a day we were like playing one day, and I twisted his hand because he was trying to like pull my hand. Up till today, he's having pain in his thumb, and he thinks it's because I twisted his hand. Maybe how many years ago? I'm telling him, maybe he has arthritis in that finger. He can't keep blaming it on me. Anyway, side talk. Okay, rheumatoid arthritis. Your immune system attacks healthy cells in your body. RA mainly attacks the joint, usually many joints at once. RA commonly affect the joint of the hands, the wrist, and the knee. RA can also affect other parts of the body and cause problem in organs such as the lung, eyes, and the ears. So look at this picture. This picture sort of really summarizes it and goes straight to the point. You can see how a normal joint look. These are the bones, it can move, because it has the cartilage right here that covers the bone, and we have the joint, of course, and then we have the synovial membrane right there, and then we have the bone itself. So all this element that surrounds the bone, it makes it easier for it to move. It's almost like the way people put like oil in their car and the engines in the car is running smoothly. And then when the oil is like maybe dirty, or the oil is almost done or is finished or need to be replenished, then your car start acting funny. Something like that. So osteoarthritis, you can see what is happening in this picture with osteoarthritis. The bone ends are rubbing against each other. So we see that the joint capsule is not like really there, and that affects, the bone. But when the bone is not created to rub against each other, so it hurts. And the issue with rheumatoid arthritis is that inflammation. You can see there's erosion going on with the bone because of that swollen, inflamed synovial membrane. So that's what's really going on internally when you have all those pain with that. So what are some of the treatment we have there? I know there's medications, of course, that you can get. Physical exercise, so it's good to move. Of course, if you're having pain, you want to consult with a specialist, before you do any exercise excessively. But you can walk. Walking is always good. Instead of, just allowing the pain to tie you down as much as possible, you want to maintain that habit of walking. Protect your joint from injury. Even when you're moving things, when you're carrying things, you want to be mindful. You want to move, you want to be intentional in the way you move. You don't want to abuse your joints, So also that's where even weight loss even coming into play. You want to be protect your knee joint, because if you're heavy, then it's still gonna affect your knee, and all those things work hand in hand. So let's just be mindful of our health and be intentional in what we do. I know that's a short and straight to the point. And somebody said, Rosie said it hurts. And then I think that's with Sabrina with the iPhone that says it deforms the bones. Okay, that's all for arthritis this evening. I don't know if anyone has any comments, any question, or you want to just share your experience regarding arthritis. We'd like to hear from you. As Dr. Kunish getting ready to share a slide.
Can I say something? Good night.
Absolutely. Absolutely. Good night.
I what no, I don't have arthritis, thank God. But one thing I know for the food, I'm not it don't affect me really. But one thing will is orange juice. Oh my God. Orange juice have so much acid that it hurt your joints. I know for that one. Orange juice. That's the only one I can talk about.
Okay.
Orange juice. If you want orange juice, buy the fruit and squeeze it. But orange juice is what makes. I had that experience and I stopped it for years. And
Okay.
other people, yeah, but orange juice and lime juice too. You see, orange and lime is acid. Lemons are alkaline. So lemons shouldn't hurt, it's alkaline, and you need alkaline in your blood. But orange and lime, I could fall to that for acid in your joints. Okay,
Yeah,
that's it.
I guess it all depends on the person. Like for me too, I don't like orange juice. Even before it gets to my joint,
Yeah.
I can't tolerate orange
No,
juice.
I neither. I don't
Yeah.
like.
So but some people might be able to tolerate it, and if it's not affecting their health, then that is okay. But it's good to be mindful of that, to know that
Yes,
certain kind of food can have this kind of effect,
yeah.
and then you'll be mindful of how much
Then,
of it you consume. And if you start feeling one kind of feeling funny around the time you're taking those kind of food, you want to pay attention to it. I know.
I,
Thank you very much, Sister Ingrid. Sister Rosie, you have your hand up.
Yeah, I just wanted to say, um, I was a word processor for many years, and so I was at the computer, and I know that I destroyed my fingers, all my joints, my
Hmm.
neck, from the phone, and I attribute it to that. And then sitting down, my back, I have the endosopathy. But let me tell you something. I don't usually complain. This may be one time in a million because I'm living with it. I'm doing all right. But I'm saying I know that repetitive sitting there with the computer and typing and all that stuff, and it messed up my body. It messed up my body. So what do you've heard the endosopathy, Dr. Crony? You ever hear that? The condition endosopathy, does that ring a bell? No,
No, not that
no.
terminology.
It's all the joints, but I just thought I mentioned. I mean, that's what causes it. This constant repetitive. I'm saying to you, is this
So
correct?
that is why in a lot of organizations today, they have everything has to be ergonomical, like your chair, the way you position yourself. Like in the Department of Health, we have especially that come around so often observing the way we're sitting to make sure our posture is correct. So and it's also encouraged if you walk a lot on the computer every 20 minutes, you want to look away, you want to get up. You don't want to just be stuck there, especially in this day that a lot of people are working remote. So it's really important to take that time to take a break from looking at the screen, to take a break from typing, to switch up the activity from the one that makes you just standing still to other activity. Maybe just go to the photocopy machine, make some copy, or go over a colleague you had to talk to about something, do a little bit of something else in between and not being stuck for 3 hours, 4 hours, just like typing and just looking at the computer. So that's one of the things that, we always share with our staff. And that's one of the things I try to practice. I get up a lot in between my work day, even if just for 10 minutes, go to the other hand of the building, then come back, sit down again. Yeah, we try. We are not always successful, but the most important thing, we have the knowledge and we can be intentional in what we do going forward. Okay, so Dr. Crony is ready. 7:16. I'm going to hand over to Dr. Crony. Go ahead.
Okay, good evening, everyone. So this is the COVID update. I'm sure many of you have heard the president's interview where he declared that the pandemic was over, but I think he misspoke, not really understanding the conditions that still exist in the United States. There are many thousands of people that continue to die each day from COVID. So the mortality rate is still going on. It's just that we've chosen now a different path, which is to, take off our mask and not follow the protocols. But I would caution everyone to be wary, because COVID has surprised us numerous times in the past, and we should always be on guard. So with that being said, for New York City, the rates are decreasing, but as you can see from this slide, that 9.4% positive is still high. It's nowhere near where we were back in March, where we were running about 1.2% or so. So it's still elevated. It's high. It's last week. It was 10 point something, and it came down like 1 percentage point this week. But the cases are still averaging almost 2,000 cases, daily average cases. And that's an underestimate, as we've spoken before, because people are utilizing the at-home test kits and may not be reporting that they have COVID. So we don't really actually have an accurate rate of daily cases. Hospitalizations in New York City came down, and deaths are just slightly decreased. I think last week there were 9 deaths, and this week there were 7 deaths. So that's where we are with that. I'm sure the other bit of news that came out today or yesterday was that New York State Governor Hochul did not renew the emergency declaration for COVID. So therefore, once this declaration runs out, that's it. And as everyone knows, we have been struggling with with testing, with vaccination, etc. So this continues to be an issue, but COVID is still circulating in the city. So our key messages have not changed. We continue to encourage everyone to get vaccinated and to get boosted and to get the new bivalent booster. All individuals or New Yorkers 12 and older are eligible to get a booster if it's been at least 2 months since their last vaccine dose, and 3 months if they had COVID. And so we continue to encourage people to wear their mask in indoor public settings, test before and after travel or large gatherings, or if you were recently exposed, seek treatment if eligible. We have Paxlovid as treatment. Stay home if you're sick, and definitely wash your hands. So right now across the city, in the neighborhoods of inequity, the zip codes of inequity, where about 70% of residents are fully vaccinated. So that's really good. And across New York City as a whole, roughly 95% of New Yorkers have been vaccinated. And this is all neighborhoods. This is everyone across New York City. But however, those that are 65 in the underserved zip codes, only about 50% of residents have been boosted with the new booster, or any booster for that matter. And so the goal now is to try to get those that are 65 and older to get them to be boosted. So you may ask, why is this so important? Well, a study came out in the Journal of Alzheimer's Disease showing some sort of correlation with COVID-19 and new onset Alzheimer's disease. So, of course, more work needs to be done in this area, but there is an early trend noting that those who are 65 and older and who did not get vaccinated, who did not get, the proper vaccinations for COVID are at risk, at increased risk for a new diagnosis of Alzheimer's disease. Now, we know that it takes many, many years to develop Alzheimer's. It's not a, sudden onset kind of disease, but there is something about how COVID behaves or changes the body or changes the brain to cause the symptoms to be accelerated. So if there's any reason to get boosted and to get vaccinated in those 65 and older, is to try to avoid Alzheimer's disease. Okay, so with that said, poliovirus, go on to poliovirus, and it's detected in New York City, and it's in the wastewater. And so therefore it's circulating in the community. The recommendation now is that most adults in New York City were vaccinated against polio as children, and they really don't need to get vaccinated again unless they are specific medical circumstances, which may, with your provider, you may make a decision to get a booster for polio virus. And especially if you're working in an area or you handle specimens that are contaminated with polio, so there's special circumstances, exceptions to this. And of course, that has to be discussed with your provider, or if you're employed at a hospital and you're exposed to lab specimens which may have polio. So those are kind of the exceptions. But the real at-risk community is the children. So across the city, our children are fallen far behind in all of their vaccinations, not just for polio, but for everything from measles, mumps, rubella, all of the childhood illnesses. Our children are far behind, and especially in our zip codes of underserved communities. So for example, in 11691, in the Rockaways in Southeast Jamaica, Queens, the rates of immunization for childhood diseases is very low. So this is one of them. And so children are at risk, and you should encourage the parents to take their children in to get their vaccines and make sure that they're up to date, and especially since polio is around. Let's see. Okay, so yeah, basically this is what I said, is that child vaccination is dropped, and everyone who is unvaccinated, especially children, should get vaccinated. And you can check the children's vaccination record, or just go to their pediatrician and, to have this discussion with regards to all of their vaccinations, not just polio, but all of their vaccinations. And of course, New York City has resources for you if you don't have a doctor, or you're not sure, or you have more questions, etc. So you can always go to 311, call 311, or go to the resource page as listed here. And that's it for my presentation tonight. If there's any questions.
Yes, I'm sorry.
Go ahead, Rosie, and there's a question in the chat.
Okay. My three grandchildren, the father and the mother, they live right in the zip code 11692, and he works in the 11691 zip code. Now, what I want to know, they all vaccinated and all that, and he comes home, from that zip code. But I'm just wondering, is there any concern? Because they do all kinds of, they're in all kinds of activities in that area, with
Well, what I would recommend,
all kinds of things they go in that area. Go ahead.
yeah, what I would recommend is, that he spread the message to the parents and to the community to check on the vaccination. The parents should check on the vaccination status of their children, make sure that they're up to date with all of their vaccinations, and encourage them to go to their providers or to local centers. There's the Joseph Adabo Center, there's St. John's Episcopal, there's, a number of centers in the area, and just make sure that the children that are involved in the varying activities, after school activities, etc., are vaccinated and up to date on their vaccines.
I'm just saying it's impossible, because all these places that they go to, like for gym or for all kinds of activities, they go to all these places. It's impossible to get those organizations to abide with that.
Well, the one thing is that
my grandchildren, even though they're vaccinated, well, not to worry. Is that correct?
If
my grandchildren.
Yeah, if they're vaccinated and they're up to date on their vaccines, they should be good. But remember, the lesson that we've learned over this past, 2+ years, especially in the Rockaway zip code, is that slow and steady wins the race. So we continue to spread the message. It may not seem as though we're making any progress, because sometimes it appears that it's imperceptible, but that's actually not the case. It's just slow progress, and not giving up and not going backwards and not, retreating or giving up any ground. It's a matter of just being persistent and to pack your patience. Okay, because it's you want to see things happen immediately, but that's not the way it works. You have to be patient and trust that the system is working, that your messages are getting out there, and eventually the message will get through, and people will change their behaviors based on the information and the message that they get. But it's a slow and steady process that has to happen. Okay. There's a question in the chat about booster requirements. I don't know. Can you unmute and ask the question, please? Because I don't know which booster you're referring to.
Yes, hi. I just wanted to ask, with the new COVID vaccine and also with the old COVID vaccine, with both, because I'm really not sure, are there any COVID boosters for children under 12 years of age?
They will very likely use the same bivalent booster, but it's a matter of timing. Okay, because remember, the children from 6 months to 4 years old, and from 5 to 12 only recently started completing their primary vaccines. So it's just a matter of time before they release it for children under 12.
Okay, so right now there's no like recommendations for boosters for children under 12.
Not yet. Give it a little bit of time because, we're looking at the clock as to when children under 12 got vaccinated. It's all according to the clock. If you
Okay, thank you.
understand what I mean, yeah. So like, for example, we know that the vaccination for those children, especially 6 months and above, didn't come out that long ago. So it's not yet time for them to quote unquote be boosted. But as soon as that deadline, as that clock ticks by, then they'll come out with the recommendation and have the supplies ready.
Thank you. I also have one
Okay.
more question with the
Sure.
booster. So with the with the booster now, with the bivalent, so whoever received the monovalent vaccines are now recommended to get the bivalent vaccine.
Yes.
And I think from the last meeting you said it is a mRNA vaccine, right?
Yes, absolutely.
Okay.
That's the
Okay.
recommendation. Absolutely.
Okay, thank you so much.
Okay, no problem. Also, just an interesting tidbit. It turns out that in the neighborhoods with that are underserved, people tend to get the flu vaccine at a higher rate than in the other neighborhoods. So in our neighborhoods, the seniors and everyone tend to get the flu vaccine at a rate of 70% or higher. So we just need to encourage people to get the booster the same way they would go to get their flu vaccine, include the booster as part of their regimen. Okay.
There's one more question in the chat from JT. JT, you want to read your question out loud?
I was typing, but yeah.
Oh, okay.
I was asking if we had any updates on what we know about long COVID.
Well, that is a continuing area of research. Certainly, this correlation with Alzheimer's might be considered an effect of long COVID, because now we have to wait and see if this data is supported over time, because this is the information about Alzheimer's is just what's noted now, but we have to wait over time, just like with long COVID, and this probably would be considered a long COVID condition. So, but we just have to wait. Time is going to tell us more about long COVID.
Thank you.
Okay.
Okay.
I'm sorry, there was one other question I see. For the booster is available. It's available and it's free. Okay. And it's available at, it should be available everywhere at your local pharmacies. Certainly the Department of Health, and certainly sites in Far Rockaway, sites like St. John's Episcopal and Joseph Adabo Center, the vaccinations are available. What is a problem is getting tested, because now there's no more funding for testing. And so the varying outfits that are doing testing are charging for testing. So, and that will continue to accelerate as a problem if the Congress doesn't step in and provide some other funding. So.
Okay, thank you, Dr. Connie. I think I don't see any more questions. I say thank you for the information and thank you for the information. Okay, we're gonna call on Dr. Sunday to come and give us update on the monkeypox. I apologize for this slide before I start showing this. Like the background is like crazy sometimes. You might not see it properly, but yes. Okay.
Good evening, everybody. For the monkeypox, we know that the MVA has been approved for prevention of the monkeypox. That's the vaccine that has been approved for the monkeypox. And one of it's a highly contagious virus that you can get by being in contact with whoever has it, skin to skin contact, sexually, can be transmitted sexually through body fluid contact. And one of the myths is that the only people who get are people of like gay and bisexual, but anybody can actually get it if you get in contact with people who has it. That's why even in the hospital, they do, the patient is put on contact isolation once a patient has been diagnosed as having the virus. Can you go to the next slide, please? So we know that in US, the MVA has been approved as the vaccine, and the first and second dose is available for whoever is interested to get it. You can get the first dose by walking into all the city-run sites. We have them. If you need the information about those sites, Relum Foundation can get that to you. And also they have apps that you can register to get the vaccine, and then for the first dose, you could actually walk in to get the vaccine, but for the second dose, they require that you make an appointment. Even the first dose, it makes sense because sometimes when you go to some sites, there's a lot of people and they tend to respond to people who register first. So it makes a lot of sense to register. So we have the first dose. Once you get the first dose, 28 days after the first dose, you qualify to get the second dose. So some of the questions that has been posted to me in my practice is that people, because of they've been exposed to the COVID, a lot of people is asking questions about the booster. So when we get the first dose and we get second dose, when do we get the booster? So, I mean, to answer that question, in case there's anybody here who has the same kind of question, is that the United States Advisory Committee on Immunization Practices has recommended that people that at high risk of occupational exposure to the virus are recommended to get the booster every 2 years. But we're not talking about the booster now. We're still just trying to get people to get the first dose and the second dose. And people who are at lesser risk, it's recommended that they'll be taking it every 10 years. But for other population, it has not been established when they're going to be getting the booster. But we know about those people who work in high risk occupation. So we know about that. And this vaccine is available to people 18 and above, and also 18 and younger. So for the people who are 18 and above, it is recommended that they get the dose through their intradermal administration. So it's just like when you go get your PPD, it's going to be underneath your skin. That's where they get it. And it's a little small dose, it's about 0.1 ml per dose. And that's what they put into your arm for you to get that dose. And anybody that, the only contraindication for the intradermal administration is if you have history of developing keloid scars, so they don't want to use that site for you, especially if you have that. And anybody that is younger, it is suggested that they get it into the fat tissues, sub-Q, and that's where they're going to administer the vaccine. And for that is about 0.5 ml per dose, and that's what they'll put into the sub-Q, and that is like in the stomach area, your forearm, like your upper arm. They could put it into those area. So other questions that I have been exposed to is that people ask that, can this vaccine be administered with other vaccines? So there's no study yet evaluating the co-administration of MVA vaccine with other vaccines. However, in general, MVA may be administered with any without any regard for timing or of other vaccines. So you can get the vaccine. You know, if someone recently received the COVID vaccine and then had an exposure to the monkeypox, it is highly recommended that you do not delay in getting your vaccine. So other questions that is being asked is that people want to know what are the adverse reaction to the vaccine. So it's just common adverse events seen after the vaccination of the MVA includes site reaction. You know, just like when you get your PPD, you might see some reaction in that area. You see some site reaction where you get it. Or sometimes people say they have headache. Some people complain of body pain. And those are the stuff that is being recorded for now regarding the adverse reaction. And then people ask, what are the contraindications for getting the MVA? The only contraindication in that is for people who have serious hypersensitivity to any component of the formulation. This includes those with history of severe allergic reaction to, for example, Cipro and gentamicin, because MVA vaccine contain trace amount of this agent. So these are the kind of people that just want to be really careful. If you know that you have an allergic reaction to those medication, or if you know that you are allergic to egg, because the virus was grown in a chicken embryo. So those are the contraindication that is highly advised that you should talk to your doctor before you get it if you know you have those stuff. So the people that come to the hospital with the monkeypox, most of the time what we do is that we, you know, some of them have developed the rash, you know, the rash that appear like the chicken pox or smallpox. However, mortality of the monkeypox is significantly less than that of the smallpox, because that's what we are seeing in practice. So the medical management for this virus is more towards the supportive care that we give the patient, and as well as the antiviral therapy that is given to the patient. Supportive care, like if they have a mild disease, you know, we give them for pain management, we hydrate them in case they have nausea, vomiting, dysphagia, you know, we just do that, and then we support them with the antiviral medication that has been approved for AIDS. So if you want to get the vaccine and you want to get it for somebody less than 18, the person must come and there must be a verbal consent from the parents when they make their appointment. or they have to make sure that the guidance, they write a statement of consent to be given to somebody that is less than 18 of age before that person can get it. And if there's anybody that is a minor, definitely they want the caregiver to be present when the person gets the vaccine. So, and you need also to make sure that to make the appointment, I told you that Relum is going to give you there's a app that you can use to schedule the appointment. Relum is going to provide you with that information that you can use to schedule if you're interested in getting the vaccine. And when you present yourself for the appointment, they expect you to come with your driver's license or New York State ID or your birth certificate issued by a state or local government in US. Current US passport or valid foreign passport is also good. Your resident permit is good. Marriage certificate and all sorts. Those are what is recommended to bring for their appointment. If you are eligible, you can make an appointment by calling 877-FACS-4-NYC. That is 877-829-4692. So that's where we are with the vaccine for the monkeypox. So that's the update that I have. And if there's any question out there.
There are a few questions in the chat. Is Rosie, want to read your question? So Rosie?
Oh, you want me to say it?
Yes, please.
No, I'm sorry, because I have a hard time understanding. I understand that there's a vaccine, the vaccine for monkeypox is out there, but the people who get it are the ones that go to get the vaccine, or is it open for anybody who's sexually active? I'm not quite understanding that.
So
like,
the vaccine is available for whoever wants to get it now. So you get the first dose, then the only time you are good to get the second dose is 28 days after the first dose. Whoever is interested in getting the vaccine, it's open in all city-run vaccination centers. So anybody who is interested in getting the vaccine can get it now, both the first dose and the second dose.
There is another layer. There is a screening, and there's this like an algorithm screening that they have to go through. Even though it's generally available, there's a screening of specific people that are being prioritized at this point. So there's a screening. So the sex workers, those are like of the gay and sexual orientation, because the percentage of the people that are actually getting infected, the highest is from that population. So
right.
Because they have limited resources, limited vaccine available, so the priority is in that population.
Okay, that's what I want to know.
I just want to, Maureen, before you had your piece, I know you've been at the meeting, hold on, Maureen. But if you were also exposed, let's say, for example, you're not in that category, but you were exposed to it, you feel like I was by somebody that had it, so you can still be able to get it. Go ahead, Maureen.
Yeah, I was just, I'm not gay, I'm not bisexual, I'm not transgender. And if I just wanted to walk in and try to get the vaccine, you're saying I can get the vaccine?
I don't think so. Because you have to have been exposed. You have to have been exposed.
No, okay. Okay, now it's clear. Now it's clear.
Yeah, okay. Because
for example, if you're not gay and you're not bisexual and you're not transgender, and for whatever reason, let's say your partner has it and you're like, oh, I've been exposed to it, or you're in close contact with somebody that had it. Yes.
It is highly recommended that if you see that you have unknown rashes in your body, that it is recommended and advised to people that they stay away from sexual contact, and such person should go and be tested to go to attempt to get the vaccine. And if you have somebody in your house that you see some strange rashes, people are encouraged to go and walk up to the city centers, and based on that, you'll be able to get it.
Maureen, you were saying something?
Yeah, I was just going to say that is it recommended that once you have monkeypox that you get the vaccine, or do you wait until you're done with it and then you get the vaccine? You can't get it while you have the actual disease, right?
I think one of the main reasons why they wait, whether it's monkeypox or COVID-19, and say you need to wait before you get it, is not because you can't get vaccinated while you have monkeypox. It's because of the exposure. Because if you want to go get it, you're gonna go to a place where people are gathered, and you're exposing other people.
Oh,
so
okay.
You have to get well first, and not be contagious before you go out there, so you can protect the community.
Okay.
Sister Donna, you have your hand up.
Yeah, it's about the COVID-19. You said the testing is ended already. That's what I wanted to know. Or is it the end of the month?
Free testing.
The free testing is ended.
Yeah.
So the ones on the buses and stuff, Dr. Cheryl?
There are only a few vans. If you notice in the neighborhood, there's usually one in front of Allen AME. There's one on Farmers Boulevard. There's another one on Baisley by Roy Wilkins Park. So there's limited vans for testing.
Oh,
and
I didn't know
they're all city-run vans. But before, you used to be able to go to your Walgreens or your CVS and just get a test, and they would not charge you for it. But now they're going to charge you unless you have insurance that's going to cover the cost of the test.
Oh, okay.
So, Dr. Connie, that new initiative we're thinking of joining, so that will give the community opportunity to get access to that free testing.
Yes.
Okay.
Yes.
We'll talk more about that next week. Okay.
And can Dr. Coney, you mentioned something about the governor shutting down some the emergency thing with the COVID. I'm sorry.
Go ahead.
Can I just ask, was that something she decided, or was that something that the federal government decided and she's going along with it?
No, New York State has its own State Department of Health and health initiatives, etc. And for the last couple of years, there's been a declaration by the governor of New York, whether it was Cuomo, to have an emergency, to declare COVID infection as a state of emergency in New York State. And with that declaration, according to the laws of New York State, the health laws, it released monies to help with the state of emergency. So the last state of emergency is ending, and she does not intend to renew that state of emergency for COVID. So that means that any state funding associated with COVID will end.
And can it be reinstated if it need be?
Yes, she can definitely declare another emergency, state of emergency. Let's say we go into the fall now where everybody's indoors and COVID decides to take another twist or turn, and cases start to rise again, and et cetera, like we've seen in the past. She can always declare another state of emergency.
Okay. All right. Thank you.
Okay.
I think one of the takeaway, even just as Dr. Puni mentioned, is that if you have ability and you're eligible to get your bivalent booster, you don't want to wait, because you don't know if anything is going to change in the nearest future, or if the number of vaccine will reduce or whatever, because if funding is not available, all this thing costs money. The government is heavily subsidizing the vaccination. So once it's no longer on the table and the insurance have to cover it, it might be a different ball game. So we don't know. So if you can get it, so I think it's just really important for you to go ahead and make that appointment if it's available and get it. So thank you so much, Dr. Coney. Thank you, Dr. Sunday, for those updates. And I think there's something in the chat.
Yeah, Sister Rosie, yes, there is. New York State has a special initiative for immigrants to take care of really all of their needs, housing, clothing, medical. And so the immigrants or the migrants are being evaluated under that program, and their health is being assessed under that program. So with that, they would be eligible to get all of the vaccines, et cetera, that would be necessary for life in the United States.
Okay. And to add on top of that, all the students, they get registered in school as soon as they're coming in. So it's really like a robust system that they have as they welcome them in, and they're connecting them to different resources that they will need. So it's really is great teamwork that the Department of Health and all the other agencies working alongside the various agencies in the city are really doing. So it's really great. So thank you, everyone, for joining us tonight. We want to say thank you. Thank you to myself as a presenter and all the other presenters. Thank you for Sister Beverly is smiling. And thank you to all of you for coming in. Because without you, there will be no seminar or webinar. Thank you for your questions. Thank you for sharing part of your evening with us. So we'll see you guys again next week. If you have any topic you're passionate about that you'd like for us to address, please send it to myself, Dr. Kearney, and we'll make sure we talk about it. Thank you so much.
Okay, have a blessed night, everybody.
Good night.
Thank you. Have a good night, everyone.
I'm going to
Thank you. Thank you all.
Thanks to all the presenters.
Good night,
Good night, everyone.
Good night, everybody.
We are so well informed. It's unbelievable.
Yes.
Awesome. Have a
Have
good night.
that.